And I will stop speaking now as the chairman for this session with David and ask the first speaker. There is nothing more important, Martyn, than a person who has actually lived through what you're talking about. There is nothing that is more important to the safety of patients than those who, trying to deal with it, speak up when it's going wrong. But alas, this is not how the health service treats many people in many different trusts. And for this reason, we believe this to be very important, but so many of you who have suffered the indignities around the country are not really willing to talk about it. It's so painful, you're so damaged, and it's so bad for the health service of the patients and made so unsafe for them that it's got to be highlighted. And this morning, how lucky we were with the Telegraph front page. It's like manna from heaven. I call on my distinguished colleague, obstetrician and gynecologist, Martyn Pitman. He said, former. Why is he former? Well, he may tell you. Come, Martyn. I'm very pleased to welcome you. It's very courageous to come.
Whilst my slides come up, I'd like to thank Professor Somerville, the JF4D team for putting this on today, and what should hopefully be a thoroughly enjoyable, informative day. And a special shout out to Janet Easton and Gordon Rayner from the Telegraph for their sterling efforts this morning. So on the 3rd of February 2003, I realised my lifelong ambition, which was to become a consultant obstetrician and gynaecologist, and I was lucky enough to be appointed to the Royal Hampshire County Hospital in Winchester. Pretty unusual, I think, in that I not only was appointed to my dream job, but it was a dream job in the hospital where I was actually born. So I served the community where I grew up, where I was educated, where I undertook part of my formative training in obstetrics and gynaecology, and where I chose to bring up my family. And for the first 10 years of my consultant career, it proved to be the dream job. I was entirely dedicated to my patients, entirely dedicated to my career. I made massive sacrifices to provide what I considered to be the ultimate in safe, evidence-based and effective care for my patients, and was very proud of the service that I provided. In 2012, the trust merged, or in reality was taken over by our neighbouring trust in Basingstoke, and this was always going to prove difficult from the maternity side because our departments were very different structured, had a very different ethos of care. Winchester was a very traditional medical model with a very close working relationship with our midwifery colleagues, and we supported genuine informed maternal choice, as per what has subsequently come out in the Ockenden report. Basingstoke was a very normalisation pro-unit principally led by the midwives. So it was always going to be a difficult merger of philosophies, really. The thing that proved most difficult, though, was the management change in structure that was imposed on our department, and principally a group of senior midwifery managers that all came from Basingstoke, were all close mates. And it became pretty obvious, really, from very early on that this was going to pose difficulties as far as midwifery morale was concerned, midwifery working practices, and inevitably, to all of our fear, potentially, that could translate into risk to patients. So in the spring of 2019, I undertook what I believe then, and I still adamantly believe now, is my basic professional and moral responsibility, which was to whistle-blow concerns. I whistle-blew concerns in relation to my midwifery colleagues primarily because they were so demoralised, we had massive sick leave, and that was threatening their ability to provide safe care, particularly in the realms of processes like inductions of labour and elective caesarean sections, which were being delayed. And there was a genuine concern then that if we as a group of consultants, and I acted as a spokesperson essentially, which I was pleased to do at the time, probably naive in doing so, So I raised these concerns, which we feared, if action wasn't taken, could adversely affect patient care and threaten mums and babies' lives. Prior to this point in time, I think I've been pretty much an exemplary consultant. I've been practicing for 26 years, had 26 years of flawless appraisals. I had 2 impeccable GMC revalidations, the last one having been signed off by the very person who 2 months later was my MHPSI case manager, just 2 months before that process began. I neither expected nor got any thanks or praise from the Trust. The only thanks and praise I got were from the patients that I served, many of whom were staff members in the Trust, managers, consultant colleagues, junior doctors, local GPs, other medics around the region who chose me to look after them. That was all I needed. This changed rapidly, as Salam very eloquently described, and you suddenly see yourself as a pariah when you get faced, as I was, with the whole thing was turned around, and I was confronted with allegations of bullying, harassment and undermining behaviour, placed on an immediate formal investigation protocol, which, as we all know, those of us in the room that have been through it, an MHPSI, which was the most debilitating, destructive, lonely, depressing process that I think any dedicated professional clinician could possibly pass through. So this process went on. I won't go into the details of it because of time constraints, but it went on not for the 6 weeks that it should have done, but it went on for years. It all started to unravel so it started in the spring of 2019. It started to unravel a couple of years later when exactly what I predicted would happen happened. We started to see avoidable disasters, and this was one example that by this time I knew my days were numbered, so I whistle blew internally and I whistle blew to the coroner about this tragic case that I still adamantly believe was a completely avoidable maternal death, and that basically signed my death or my career's death warrant in the Trust by raising concerns about this case. Again, unfortunately for the Trust, in late 2021, CQC descended on the Trust. I was blamed for that, having apparently called them in. I had nothing to do with it. They descended on the Trust to do a formal maternity investigation, which was condemning. The report for that was released in February 2022. So nearly 3 years after I raised my initial concerns, every single one of my concerns, particularly around unsafe staffing levels, were then raised and highlighted in the CQC report in February 2022. The Trust then presented their side of the story to the local press, indicating that all of these problems were new, when in fact that was very far from the truth. I then became too hot to handle, so I then went on a spiral of descent into what ended up being my dismissal from the Trust. I received immense support both from local and national press, and also from Sarah Parish, who was a famous actress who I had the pleasure and privilege to look after. And the amount of support you get from this and through social media, through Facebook patient groups, was immense. It made such a difference to both me and my family whilst all this horrible stuff is going on in the background. Just prior to what became my employment tribunal, the Trust then ventured onto a process of positive spin. So their social media pages were awash with everything that they did to support freedom to speak up and whistleblowing. And this was obviously pre-staged before my employment tribunal. It even went as far on the right-hand side of that, of them paying an artist to paint murals on walls in each of our 3 hospitals, saying what a great cultural transition the Trust was going through. So I then proceeded in late September of last year to go through an employment tribunal. I don't intend to go anywhere near what happened in that. Most of that's been very well covered in the press and on social media. I lost. And then some strange things happened this year. On the 4th of January this year, the Trust called in the local TV channel to reassure them about the safety in the maternity unit after the difficult time they'd had. And this culminated with the chief executive being asked whether she felt the unit was safe to have a baby. And she gave a very unconvincing answer. Less than a month later, in a neonatal morbidity and mortality meeting, this slide was shown, and just read the top line on that in the year following my dismissal, so the consultant who dedicated one aspect of his consultant career to minimising HIE rates, which is hypoxic brain damage to babies, they detected a significantly worse level than the network average. When pushed about this, by The Guardian and the local newspaper, the Trust were admitted that the rate had not only increased, but it had gone up fivefold in the 12 months since my dismissal. It's a quite startling figure, and an example of how my warnings about patient safety then came to abject and black and white fruition. Hot off the press last week, it was then reported in the local newspaper in the Hampshire Chronicle that the Trust had decided not to call in an external investigator to investigate these cases, but to do their own seemingly behind closed doors internal investigation, which they've subsequently completed, and they've now decided that the rates that were quoted by their own neonatologists were actually incorrect. And surprise, surprise, their internal investigation has downgraded those numbers. They're now within the accepted normal range. Good Lord, who would have thought it? So this is a picture that I was sent by a patient of one of the very last babies I delivered, a moment that I was as proud of 30 years into my career as the very first baby that I delivered 30 years earlier. And I'm immensely proud. I never mentioned this or boasted about it in my time when I was practicing, but I was forced to the end of my career at a point in time where I had never had a serious clinical incident attributed to my poor decision-making in obstetrics, a record that I was immensely proud of. I have no idea what's going on really as far as patient risk and concern in the trust that I served. I do have, as I hope I've highlighted in the brief slides that I've shown you, I do have significant concern, and one of my biggest concerns aside of the clinical side of things is because of the way I was treated. I think that has a trade-off to other members of staff in the organisation who I would imagine are absolutely paranoid and full of fear about the risks if they raise concerns and whistleblow in view of what has happened to me. Thank you.
Thank you very much, Martyn, for so courageously talking about yourself. It is not easy